Good day and Assalamualaikum. I am Farah Nalundong, nursing student at MSc campus. So this time I will be assessing the male genitourinary system. So the definition of it is the male genitourinary system are the organs of the reproductive system and the urinary system. So the purpose of it is to detect if there's any abnormalities that may range from life-threatening diseases. So the equipments are gloves, PPE, and mask. So the considerations before, during, and after the procedure: introduce self, verify client identity, and explain the procedures, perform hand hygiene, and provide for client privacy. So the things to document after the procedure: document all findings, normal and abnormal response of the client to the procedures.
Assessing the male genitourinary system. First procedure: introduce self and verify the client's identity. Explain the procedure to the client. Provide privacy. This is to gain cooperation and lessen the anxiety of the client. Ask the client to empty his bladder before the examination begins. This is to provide client's comfort. Perform hand hygiene, apply gloves, and observe appropriate infection control. This is to minimize contamination. Don on clean gloves. This is to minimize contamination. Ask the client to remove his underwear. Place him in a supine position with legs slightly apart and drape. This is to provide good visualization of male genital. Do the perineal care. This is to prevent the spread of microorganisms. For pubic hair, inspect the distribution, amount, and characteristics of pubic hair. For normal findings, triangular distribution, often spreading of the abdomen. For abnormal findings, scant amount or absence of hair. For penis, inspect the penile shaft and glans penis and note the skin condition, presence or absence of foreskin, position of the urethral meatus, and any lesion, swelling, inflammation, or discharges. For normal findings, penile skin intact, appears slightly wrinkled, and varies in color as widely as other body skin. For abnormal findings, presence of lesions, nodule, swellings, or inflammation. For scrotum, inspect the scrotum for skin condition, size, position, and symmetry. Inspect all skin surfaces by spreading the rugated surface skin and lifting the scrotum as needed to observe posterior surfaces. For normal findings, scrotal skin is darker in color than the rest of the body and is loose. Size varies with temperature changes. For abnormal findings, discolorations, any tightening of skin may indicate edema or mass, mark asymmetry in size. For inguinal area, inspect both inguinal areas for bulges while the client is standing if possible. First, have the client remain at rest. Next, have the client hold his breath and strain or bear down as though having a bowel movement. Bearing down may make the hernia more visible. For normal findings, no swelling or bulges. For abnormal findings, swelling or bulge possible inguinal or femoral hernia. Remove and discard gloves. Perform hand hygiene. This is to prevent the spread of microorganisms. Document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate. This is for future evaluation.